The first race that I was ever in, I can still recall today the adrenaline rush. There's an excitement. It's exhilarating, but there's a very focusing element that takes place.
I've been painting since 1985. When I go out to the studio, the canvas is empty from start to finish. I am totally involved with the piece.
You're not thinking about anything else other than what's at hand.
You get into a zone, I would say. It's a wonderful process. Painting really rejuvenates my soul and makes me the happy person I am. Mike and I grew up together in Hood River, Oregon, small town. Our parents were friends. We'd actually camped together as kids, but I was 3 years ahead of him in school, so really didn't pay any attention to little Mike Gaulke. Ran into Mike, hadn't seen him for years, and we just sort of hit it off right away. 6 months later, we were married. And we've been married 49 years.
Judy and I are both two-time cancer survivors. Judy's had breast cancer, and when I was 27, I had testicular cancer at a time when that was near a death sentence. And I'm here today because the doctors at the Palo Alto Medical Foundation saved my life. Over the years, I have very much felt a debt that I wanted to repay. So I got involved about 30 years ago with the Palo Alto Medical Foundation. Then that has morphed into Sutter Health as well. Living in Silicon Valley, when I look at how healthcare is taking and dealing with innovation, the two are not connecting. Innovative ideas don't populate quickly through the healthcare system that we have today. Sutter is blessed with being able to take care of 1 out of every 100 Americans. We have an opportunity within Sutter to really have an impact in healthcare. And that's what the Innovation Center hopefully will be able to do.
In 2016, we started the innovation function at Sutter. We look across the spectrum of what health means in somebody's life. We started looking at what's the patient's experience and what are things we can do to make the experience better for them, but none of it matters until it hatches into somebody's life. So the hatchery was formed.
In the hatchery, it's meant to understand what is it that Sutter can do to make the experience better for our patients or for our care teams, and we find those places where it's confusing or it's hard, and we try to find solutions for that.
We go out into people's homes, we hear about their lives. We really serve as kind of the eyes and ears outside the walls of Sutter as it's known. We run our projects and pilots for 90 days, and really at the end of those 90 days is when we decide, is this something that is feasible, viable, desirable, and are we moving it forward?
And that swiftness, listening to what people really want and identifying what the latent needs are, and then going to that patient's world within 90 days is what the team is all about. We've looked at ride sharing. Can people drive themselves to an appointment? They may not feel well. They may need a ride home after a surgery. And so we're working closely with Lyft and other ride sharing service companies.
One of the more exciting ones is the use of Google Glass in the exam room, having a physician engage with you eye to eye rather than his back turned, entering information on the medical record. It's an exciting example of the kinds of things that can come out of the hatchery. Judy and I believe so strongly about the innovation efforts here at Sutter Health that we are excited to be able to establish an endowment to support the Innovation Hatchery.
Our landscape of care is so diverse, from rural to urban, all socioeconomic levels, all races. And so to do this work out of Northern California truly sets the scene for a global representation of how care could be delivered in ways that are emotionally resonant, meet people where they are intellectually, and physically treat them in the best possible way. And that's what the hatchery represents. So the Gaulkes have really helped set the scene here to do this great work. This really represents our research teams, our clinicians, our operational teams. They all come together in this thing we call the patient experience. This isn't just about funding, this is about where that funding comes from. And Mike and Judy as people, the fast and slow, the creativity, the artistic, the engineering, the thoughtfulness, these things all converge in their relationship, and they happen to converge here in the hatchery as well.
We decided to do this at this point in our lives because we'd really like to see the results. So I was very excited when I heard about the Innovation Hatchery.
The real hope for the partnership with Sutter is not only to be successful within the Sutter system, but over the next 10 years, if others will be looking to Sutter as an example of how to take innovation and make it an integral part of their programs in healthcare. My life has been so blessed for the last 49 years to be with this lovely woman. She's complimented me in so many ways. It's really been truly our success together. We've had a great life, and we aren't done yet.